Good morning and welcome to this discussion on changes in training, lifestyle, psychosocial, and demographic factors in association with running-related injuries during COVID-19. The authors of this study were Holmes, Monahan, Strunk, Paquette, and Roper. The purpose of the study was to look at how individuals were affected by COVID-19 pandemic restrictions that influenced running-related injuries, and to see how lifestyle and psychosocial wellness changes running behavior. The objective was to look at changes in running behavior because of COVID-19 pandemic restrictions, and the secondary was lifestyle and well-being may influence behavior changes in running. The authors chose to take a second look at this information because they saw some opposing views and inconsistencies in research showing training at a higher distance was protective of running-related injuries. And so they chose to research this further. The methods was an online survey given out through social media, email, or running communities. And on the survey, there were questions that involved running injury details, training behavior, environmental, social, psychosocial changes before, during, and after COVID-19 pandemic restrictions, along with any barriers that could have been caused during that time. The results of the survey was that during COVID, 9.5% of participants sustained new injury, and most significantly, the participants that sustained a new injury actually had the greatest total change in their lifestyle affected by COVID-19 pandemic restrictions. There was an increase in outdoor activity as well as an increase in loneliness during this time. The discussion along with this survey was that work changes affected the amount of time individuals could exercise. There was an increase of feeling lonely due to injury or barriers, and the number of changes affected running-related injuries occurrence. Now, I chose this study to do because I think it's really important as a healthcare provider to look at all aspects of an individual's wellness when treating.